So hi guys, today we'll be talking about the caseous necrosis. This caseous necrosis is eventually a part or a manifestation of a disease concerning with tubercular lesion, right? The tubercular lesion that forms the granuloma, they have a caseous structures, cheese-like appearance in the lesion, and that leads to tuberculosis, right? So since it is of necrotizing factor, it can also mimic like a pseudo tumor, right? So as a tumor grows and metastatize in that fashion also, this granulomatous lesion tends to have a tendency to behave and mimic like a tumor. So that's why TB granular lesions that are the gone complex that are formed in the X-ray, in the, you can say, hilar and mediastinal portion of the lungs, that caseous necrosis can be termed effectively to mimic like a pseudo tumor, right? So it has same characteristic like the tumor lesion, right? Apart from that, they have a tendency to form a lytic lesion also, that could produce osteoclast in bones and lead to the tuberculosis of bone also. Apart from that, the smooth muscles are the soft target for tuberculosis, right? So usually it can lead to GI tract tuberculosis also, in the bladder also, and in very rare cases it can tend to have tuberculosis of eyes also, right? So regular screening is important. Apart from that, HIV associated tuberculosis is also a very rare condition along with the warty manifestation, right? So apart from that, if we talk about the papillonecrotic lesions, that has been a regular fashion of manifestation in HIV associated in individuals, right? These lesions are somewhat mimicking like molluscus contagiosum, right? So it's very difficult to have a differential diagnosis in that. So the best part is to go either for skin biopsy in case of papillonecrotic lesion, and bone aspiration and CBNAT testing for bone tuberculosis or extrapulmonary tuberculosis. Apart from that, regular X-ray along with that next generation sequencing of TB antigens can give you a fair idea that how much antibodies are produced in terms of a TB infection, right? So you can be screening yourself for at least once in a year, right? So this is the only way we can uh, inhibit the stigma around the tuberculosis and have a very effective treatment for that, right? So treatment are concerned not in the monotherapy, but the treatment are concerned with the multi therapy programs, right? So according to WHO and FDA, we usually give the combination of ethambutol, isoniazid, and pyrazinamide, right? So these are the first line of drug for tuberculosis, okay? And the medication runs from 9 months to 2 years. So approximately, like, it usually take 2 years to properly heal the infection and like get rid of the TB bacteria, right? Apart from that, 8 to 9% of population still has a immunosuppression in the later stages of life because of this infection, right? So you have to accordingly fix your lifestyle and everything, so that your immune system remains in check. Apart from that, what you can do is that have a regular testing of tuberculosis and other venereal diseases also, along with the pulmonary tuberculosis and extrapulmonary tuberculosis, and this will give you the fair idea. Maintaining a proper ESR, right, and proper CBC reports and differentials of the blood, that would give you a fair idea that your body is healthy and currently not in an infected stage. So these are the stuffs we can do on a regular basis, so that you can prevent yourself from getting infection of tuberculosis. So we will discuss more about tuberculosis in the upcoming lectures. So stay tuned and subscribe my channel. Thank you.